Good morning, everyone. Uh, Today we will be doing visual acuity and blindness. Uh, Distance visual acuity is usually recorded as a ratio or fraction comparing patient performance with an agreed upon standard. In this notation, the numerator represents the distance between the patient and the eye chart. So normally we take visual acuity on a Snellen chart, and the denominator represents the distance at which a person with normal acuity can read the letters. So visual acuity of 20 by 80 thus indicates that the patient can recognize at 20 feet a symbol that a person with normal acuity can recognize at 80 feet. So normal visual acuity is 20 by 20, 6 by 6. 20 by 20 is in feet, 6 by 6 is in meters. So, visual acuity of 20 by 20 represents statistically normal visual acuity. However, many normal individuals actually see better than 20/20. For example, 20 by 15 or 20 by 10. If this is the case, you should record it as such. Alternative methods for recording visual acuity are, decimal notations. Example, 20 by 20 is equal to 1.0. 20 by 40 is 0.5, and 20 by 200 is 0.1. And these are decimal notation, as well as there are metric notation like 20 by 20, 6 by is equal to 6 by 6. So visual acuity is tested most often at a distance of 20 feet or 6 meters. Greater distances are impractical. For practical purpose, a distance of 20 feet may be equated with optimal infinity. So to test distance visual acuity with the conventional Snellen eye chart, you can just open it on Google and just write down Snellen eye chart and just look at that, and then it will make more sense. Or when you come to the clinical department, then we'll make you do a visual acuity. That's how you do visual acuity. Place the patient at the designated distance, usually 20 feet or 6 meters. So, from a well illuminated Snellen chart, if glasses are normally worn for distance vision, the patient should wear them. By convention, the right eye is tested and recorded first. Completely occlude the left eye with using an opaque occluder or the palm of your hand, alternatively having the patient cover the eye. Ask the patient to read the smallest line in which he or she can distinguish more than one half of the letters. Record the acuity measurement as a notation like 20 by 20, in which the numerator, this is very important, in which the numerator represents the distance at which the test is performed, and the denominator represents the numeric designation for the line read. So we repeat the same procedure for the other eye. If the visual acuity is 20 by 40 or less in one or both eyes, we repeat the test with the patient viewing the test chart through a pinhole occluder, and then we record these results. The pinhole occluder may be used over the patient's glasses. So this is a way to test distance visual acuity. Okay, blindness, legal blindness is visual acuity of less than 3 by 60 or its equivalent. Low vision, Visual acuity of less than 6 by 18 but equal to or greater than 3 by 60 or corresponding to visual field loss to less than 20 degree in the better eye with best possible correction. And avoidable blindness, blindness which could be either treated or prevented by known cost-effective means. So functional blindness, loss of vision sufficient to prevent one from being supporting in an occupation, making the individual dependent on other persons, agencies, or devices in order to live. This is like visual disability. Industrial blindness, it is present when a worker can no longer pursue an occupation because of poor vision. So, we grade visual disability from normal vision to near normal vision, moderate low vision, severe low vision. Severe low vision is what is called legal blindness by the US definition, which means this gross orientation and mobility generally adequate but difficulty with traffic signs, bus numbers. Reading requires high power magnifiers, reading speed is reduced, and the visual impairment is around 20 to 200 to 20 to 400 or counting fingers at a distance of 10 feet. And if we further grade visual disability, total blindness is what we call no light perception, meaning this must rely entirely on other senses. So 20 by 200 to 20 by 400 or counting figures at 10 feet is the visual impairment which happens in patients with severe low vision as defined by the legal blindness. So this is grade 1, grade 2 low vision and blindness, and see the grade 5 is no light perception. I mean, the patient must rely entirely on other senses. This is no light perception. And 20 by 200 is the uh, 20 by 200 to 20 by 400 or counting finger at 10 feet. This is the legal blindness I was talking about. Worldwide, 161 million people are visually impaired. 90%, greater than 90% of world's visually impaired live in low and middle income countries. Except in most developed countries, cataract remains the most common cause of blindness. And if you see, cataract is it's very much preventable. Up to 75% of all blindness in adults is avoidable through prevention and treatment. Infectious causes have decreased globally. Up to 50% of all blindness in children is avoidable through prevention and treatment. So, these are some of the causes of blindness. Cataract around 39%. Then refractive errors like myopia, hypermetropia. These are all the causes of like visual loss, decreased vision. Remember cataract, refractive errors, glaucoma. AMD is age-related macular degeneration, which happens in the senile population. Corneal scar, diabetic retinopathy. This is very rampant all over the world. Uh, then there are childhood causes, trachoma, onchocerciasis. Uh, Causes of blindness in developed countries, accidents, glaucoma. Glaucoma is one of the leading causes of irreversible blindness worldwide. And With that in mind, it is imperative that efforts to arrest or slow its development are as effective as possible because glaucoma is very important, and its cause is like the silent thief of vision. It's mostly asymptomatic, so unless the patient is screened, there is no way that the pressure could be checked, and the pressure keeps on increasing unless the patient goes to the ophthalmologist. So diabetes is very common. Vascular diseases like hypertension, cataract, uh, and hereditary and degeneration of ocular tissues. In developing countries, cataract, refractive errors, glaucoma, uh, and surgical complications, causes of childhood blindness, refractive errors, trachoma, conjunctivitis, xerophthalmia, it's a dry eye, congenital cataract, retinopathy of prematurity. And causes of avoidable blindness, cataract, trachoma, onchocerciasis, childhood blindness, refractive errors, glaucoma, and diabetic retinopathy. So I would like to emphasize on glaucoma because the global prevalence of glaucoma between the age of 40 to 80 years is around 3.54%. And the prevalence of primary open-angle glaucoma is highest in Africa, and the prevalence of primary angle closure glaucoma is highest in Asia. The number of people with glaucoma worldwide was estimated to be 64 million, and it's increasing to 76 million in 2020, and it will increase further to 101 million in 2040. So these estimates are important in guiding the designs of glaucoma screening, treatment, and related public health strategies. Uh, the reason I'm mentioning glaucoma is because it is also preventable if the patient is screened at the right time. I mean, before time, when and it could be treated properly. Uh, Age, epidemiological determinants, age, gender, malnutrition, like vitamin A deficiency, social class, geographical reasons for high prevalence in Pakistan, overall rise in size of population, major population in rural areas have poor access to eye care facilities, inadequate availability of trained health personnel, and inadequate utilization of available ophthalmic surgeons. Poor nutritional status of mother and young children, adverse environmental conditions, and domestic unhygienic conditions. Unhygienic conditions. There is increasing cases of conjunctivitis and like trachoma. Then lack of community awareness and poor health-seeking behavior. Okay, low vision aids. All low vision aids work by presenting the patient with a magnified view of object. Most are optical systems which act by increasing the angle subtended by the object at the eye, thus producing an enlarged retinal image. Goals of low vision management to increase functionality, make the most of the remaining vision, provide link to community resources and support services and education. Functional effects of low vision, loss of central vision, loss of peripheral vision, is the visual field. I would like to tell you that in glaucoma, there is the vision starts to gradually decrease from the periphery to the center. So the patient doesn't realize that his peripheral vision is because it's a slow, gradual loss of vision. So it comes from the periphery to the center. So the patient present very late because we see with central vision. So a lot of people in rural areas, they come very late with tunnel vision, and when they have absolute glaucoma and they don't, then not much can be done to save the eye. So other functional effects of low vision is glare and contrast. Issues related to decreased acuity is difficulty reading, problems writing, completing paperwork, inability to recognize distant objects and faces, and issues related to visual field loss, location of scotoma important, generalized loss of visual field difficult to compensate for, mobility and independent travel, reading may require adaptations. And issues related to contrast, need for additional lighting, there's problem with glare, increased adjustment to changes in illumination, and visual discomfort and fatigue and headache and irritability. So there should be proper lighting and devices to help low vision. There are handheld magnifiers, there are stand magnifiers, there are monocular telescopes, there are CCTVs, which are video magnifiers, are sometimes called closed circuit television systems, and generally use stand mounted or handheld video cameras to project a magnified image onto a video monitor, a television screen, or a computer monitor. So, what are the communication goals? Educate patient on eye condition, help them to understand what options are available, and how to use care for tools like glasses, low vision devices, technology, community resources, and educate parents and teachers, professionals on functional implications. Functional implications include print size, visual efficiency, mobility issues, positioning, classroom placement, lightning glare reduction needs. So I think we are done. So any questions from anyone? Can you hear me? Any questions? So all of you should know the definition of visual acuity. Visual acuity is a measurement of the smallest object a person can identify at a given distance from the eye. 20 by 20 is, uh, these are metric notations. They differ. So we can say 20 by 20 is equivalent to 6 by 6, which is normal vision. So visual acuity of 20 by 20 represents statistically normal visual acuity. However, many normal individuals actually see better than 20 by 20, for example, 20 by 15 or 20 by 10. Uh, so When we examine the visual acuity, we place the patient at the designated distance, usually 20 feet or 6 meters from a very well illuminated Snellen chart. So, this will make more sense when you come to the department and you actually perform visual acuity on a patient in front of a well illuminated Snellen chart. Then you will understand. Because this is a sort of examination that you have to do. So whenever all of you come to the ward, we'll tell you how to take visual acuity. But in the meantime, you can read visual acuity, and even you can see a video on YouTube on how to take visual acuity. And visual acuity is the abbreviation for visual acuity is VA. So, uh, thank you very much. Hope it was a productive lecture. I would recommend that you see a visual acuity video on YouTube. Then you'll be oriented. Thank you. Thank you very much. You take care of yourself, all of you.